Good morning, everyone, and thanks for joining us here on a gorgeous morning here in Columbus. Thrilled to be with you and so grateful for the rest of the members of our team that are here to share in this exciting announcement, because we really are in a critical moment for our community, just as it is for so many others around the country. At a time when we're seeing increased gun violence and homicides, while continuing to confront racial injustice and police brutality, it is imperative that we adopt additional measures to transform public safety in the city of Columbus. In all of our reforms, we're committed to delivering the right response at the right time, improving access to a broad range of social services, and focusing police resources where they're needed most. That's why we're excited to announce the Alternative Response Pilot Program here today. It will begin on Monday and last 4 to 6 weeks while we assess its effectiveness and identify opportunities for ongoing refinement and improvement. It will apply a thoughtful and focused response to non-emergency incidents, particularly those involving mental health issues, addiction, and other unique medical or social conditions. Far too often, and for too long, we've asked our police officers to be social workers, medics, and health workers. Instead, their focus should be on addressing and preventing violent crime in our neighborhoods. Asking our officers to be all things to all people hasn't served them or our community well. Alternative response is specifically designed to enable our officers to focus their attention on crimes and emergencies that are perhaps more urgent and certainly more dangerous, while connecting our residents with the services and resources they need to be safe and healthy. To make this happen, we will have a social worker or mental health nurse embedded in our 911 dispatch center to help triage and redirect calls. And we are building upon the success of existing emergency response teams by dedicating them to incidents involving mental health, substance abuse, and the needs of some of our most vulnerable residents. Our partners from police and fire, who are here today, will touch on the specifics of these changes in just a few moments. But know that these reforms will provide new support for our incredible 911 dispatchers and first responders, further align the city's resources with community need, and ensure that our outstanding public safety personnel are doing the work they were always intended to do. All of this helps to improve safety and stability in our neighborhoods and in our interactions with one another, while implementing nuanced, holistic, and evidence-based strategies to build a safer, healthier, and more equitable Columbus. I also am announcing today the city's continued commitment to the Crisis Response Center that the director of Adam H., Erica Clark-Jones, is going to talk a little bit more about. The reason we wanted her to be here today, Adam H. has been critically important in helping to inform our approach with this pilot, but this pilot is the beginning of a journey to the Crisis Response Center, and it will be totally integrated and informed by the work that we start doing on Monday, building upon Spark and React and all the other great work that our public safety personnel are doing in neighborhoods right now. So the city's committed, is all in at $3.5 million this year in the capital budget we're proposing is built on $3.5 million we invested last year for a total of $10 million over 3 years. So with that, to talk a little bit more about that, her vision for community and neighborhood safety and the role of Adam H., please welcome President and CEO of Adam H., Erica Clark-Jones.
Good morning, everyone. How nice it is to be with you all in person. This is my first in-person engagement in front of the media and with everyone, so I am joyous. Even though what we're talking about today is significant and serious, but it's looking forward, right, to a time where all of our efforts will come together in a way that's significant and meaningful to those who are suffering from mental illness and substance use disorders. Mayor Ginther, thank you. Thank you not only for your leadership in this space and for police and fire, public safety, public health, because we know that solving tough challenges, we have to do this together. And so I'm thrilled to stand shoulder to shoulder with you as we work on community solutions. So as CEO of the Alcohol, Drug, and Mental Health Board of Franklin County, I am a cheerleader and an ambassador for 33 different, network of 33 different agencies, working on the front lines, providing a full range of mental health and addiction services and supports to the most vulnerable in our community. We are seeing, and I think everyone has seen, an increased need for services across the board, including crisis care. Pandemic has only served to amplify the issues that were already here. We anticipate a 23% increase in demand for mental health and addiction and substance abuse services over the next 10 years, so a 23% increase. We know that 21% of Franklin County's 1.3 million residents will experience mental illness in a given year, and 10% will abuse or be dependent on drugs or alcohol. Some 30,000 mental health crisis episodes are treated in Franklin County annually, 30,000 mental health episodes. And mental health crisis episodes are medical emergencies, not always public safety emergencies. That's why it's so important to triage calls at the point of entry, which for most in our community currently is to call 911. We need to meet people where they are, with the most appropriate response for their individual situation. The whole mental health service industry is predicated upon that. We estimate that half of the calls that come in require police or EMS involvement, and the remainder are most appropriately managed by community responders, including clinicians and peers, individuals with lived experiences. The successful, long-standing partnership, and I thank you all for this, between the City of Columbus and the Adam H. Network is more important now than ever as we continue to work to address and better coordinate the full continuum of crisis care in our community. What does this continuum include? Well, it explores a call center option and how Adam H. can dovetail with existing 911 calls and future 988 calls. 988 is a number from the FEC that's being approved for mental health emergencies. That will be coming on board to help take mental health and suicide prevention calls. Looking at developing community-based mobile crisis response and informing the public safety model with Columbus Police and Fire. We have police and EMS paired with clinician teams, and we continue to strategize on ways to engage. We need more clinician and peer teams, and we've heard that here at Adam H., who can respond to situations where there is no imminent risk of violence. Our cornerstone, however, to crisis response is our new planned crisis center. It is being developed as the central and preferred destination in Franklin County for mental health and addiction crisis needs. This center will break ground in early 2022, thanks to the help of the City of Columbus in part and other partners. The center will offer a no wrong door philosophy to ensure that anyone that arrives at the center receives services. It will benefit everyone from individuals in crisis and their families to the overcrowded hospitals and first responders currently stretched to their limits. We're grateful for the support from the city and our other partners with the recent capital budget allocation. We look forward to seeing the results not only of this pilot as we continue to get smarter as a community, but how they can inform and improve our ongoing work to inform our continuum of crisis care in Franklin County. Thank you so much for having us here today. Thank you for being interested in this topic, and thank you for your partnership going forward. I now have the wonderful pleasure of introducing our partner. He's been at our side, and the Columbus Division of Fire has been at our side all these years in developing strong mobile crisis response, Captain Matt Parrish.
Well, before Captain speaks, I do want to acknowledge the very highest level of support for this within the divisions of police and fire. Chief Happ is here and Chief Woods. We appreciate your commitment and support to this pilot and this continuing partnership. Captain.
Thank you, Erica, and good morning, everyone. Solving a community problem requires a community response. When 911 was implemented a little over 40 years ago, it was designed for house fires and heart attacks, calls that required a rapid and urgent response. Over the years, 911 system has not evolved as quickly as the type of calls and complexity of the calls our first responders are being asked to respond to. That change begins today and involves the community and the callers of 911 and requires everyone to provide the vital information necessary to determine the right response to situations that don't fall under the category of urgent, emergent, or life-threatening. With the support and leadership of Fire Chief Happ, Chief Woods, Director Pettis, Mayor Ginther, and funding provided from our partners at City Council, we will be piloting a new triage pod call process in the dispatch center. This triage pod will be the foundation of the program and determine the appropriate level of response that matches the acuity of the call. In a way, 911 will become the care traffic control center for low acuity calls that have a nexus to mental health, substance use disorder, and social service concerns. Our public safety forces comprised of fire, EMS, law enforcement, and the professional 911 call takers and dispatchers will not be able to solve this challenge alone. The success of the Alternative Response Project depends heavily upon the collaboration, cooperation, and engagement of our community partners such as Adam H. and their network providers, along with our social work partners and medical professionals at Columbus Public Health. Our leadership team of the Alternative Response Project has been collaborating with Adam, the hospital system, schools, faith communities, and civic associations to better understand their needs and the resources currently available. But more importantly, the resources planned for the future that Erica spoke about, such as the Franklin County Mental Health Addiction and Crisis Center, the implementation of the 988 call center for mental health crisis and suicide prevention, and the new development of non-public safety community response teams will all play a vital role in the final design of the alternative response system. The good news is we are not starting from scratch or with a blank page. We will build upon the success of our current co-responder teams such as MCR, REACT, and Spark that have shown amazing success over the past couple years. We will be drawing the best aspects from each of these programs and consolidating them under one program to provide a unified response to calls that are appropriate. There will still be times that the right response may fall back upon our ultimate safety net and the traditional 911 responders such as CPD patrol and CFD's EMS crews. We will continue to train and improve their understanding, knowledge, and response capabilities to calls involving mental health and addiction crisis. This needs to include officers responding quickly and compassionately with Narcan and A&Ds, which has resulted in saving thousands of lives over the past couple years because of their efforts. In closing, the overall vision of the Alternative Response Project is to create a transparent, continuously quality improvement, coordinated system of care that spans the entire continuum of care and services, focused on an individual patient-centric approach by providing the right response in the right amount of time for treatment, access, and connection to necessary resources required to address the needs of our most vulnerable residents and individuals in crisis. Thank you. And now I get to introduce my colleague, Commander Jeffrey with CPD.
Thank you, Captain Parrish, and good morning, everyone. I think one important number to start talking about is 22,000. That was how many runs last year in 2020 that CPD responded on with a mental health context, and I know Columbus Fire has gone on thousands as well. And behind that number are people, and people that are suffering, and not only that individual going through a mental health crisis, but also their family is going through that crisis with them. So I believe Columbus officers and Columbus Fire personnel always respond well to these, and in the moment they do a great job in crisis. What we've discovered and what's been already spoken about is that sometimes the best response might not be 2 police officers, it might not be a medic, it might be a secondary responder, and that really begins in the radio room. That's really critical, and that's why we're starting off with this triage pod to try to get it right. When that call comes in, how do we best find the best service to go to that person's home? And maybe it is 2 officers, or maybe it is a medic, but I think that's a critical part of developing this process. And we've always evolved as things have changed in law enforcement. CIT was a crisis intervention team training started in the 80s. That was officers getting some additional training to deal with mental health. Then we evolved to mobile crisis teams, where now we have an officer with a clinician in a cruiser responding on runs. And if you would ask me 5 years ago, I'd say that's never going to happen, because we have different cultures colliding. But it's worked out really well. And when you can bring an expert with that officer, the officer makes the situation safe, and then that clinician can do their work and provide that professional aspect and get that person to the right place where they need. That's really important, and that's when success is built. So I think it's really important, and I've worked with all these folks before, and what's interesting now is we're kind of all getting together and coming up with a more consolidated approach so we can then look at issues more effectively. So I'm really excited, and I think the sky's the limit on this. I think it's going to take a little time to build, but we're certainly off to a great start, and we have great partners that I'm really excited to work with. So thank you once again for having me. Now I want to introduce Ms. Marion Stuckey.
Good morning. Just because a wound isn't visible doesn't mean that it doesn't exist or it's not painful. As a social worker myself, I've had the ability to work with people during what is often the most challenging and frightening times in their lives. Times when what is really needed was compassion and someone to bear witness and listen to their experiences. There are certain 911 calls that this response can and should be the norm. How we treat health and addiction is a critical question that must be faced urgently. Mental health professionals have intervened in times of crisis for hundreds of years, utilizing well-evidenced interventions that work and lean on the therapeutic relationship, which is sometimes built within minutes and even seconds. That relationship includes empathy, compassion, non-judgment, and active listening as hallmark tasks. We carefully and holistically consider each person's needs, crafting the right response at that time. I've participated and overseen teams of mental health professionals and peer supporters that have dedicated their careers to responding in times of need, including in the aftermath of violence and in the midst of a psychological crisis. I can personally attest to just how important it is that any response has to be in alignment to the crisis that is at hand to determine what resources are needed in that moment and the level of care that is most appropriate. Social workers, being a critical component of the 911 call, means coming to provide immediate access to mental health needs right during that call. It starts in that moment. Enabling that ability to assess what the response needs to be and what fits from a behavioral, emotional, and social needs lens. Our work in the call center and in the community will do just that. And CPH is proud to lead with the hiring and the training of these mental health professionals. The right response builds our capacity to work collaboratively and address the whole person. And it makes sense for specialized skill sets and professional knowledge to be at the table to best serve our community. Thank you, and I'll turn it back over to Mayor Ginther.
Thank you, Marion, and so grateful for your leadership at the CARA Coalition and with all the great work of public health and Dr. Roberts' commitment to this effort as well, comprehensive and community approach. I want to thank everyone for joining us today for all their partnership in helping us to launch this new program. I think what you heard is where we were, where we are, but most importantly, where we're headed. And that's why this pilot is so important to continue that. This alternative response program is an important step forward in expanding vital services and resources for all of our residents and providing empathetic, timely, and specialized care for those who need it most in our community. I'm grateful to all of our police, fire, and frontline first responders for continuing to embrace creativity, innovation, and collaboration as we strengthen and reform the work that we do that directly impacts those who we all serve in this community. I look forward to seeing this program in action and advancing our efforts to transform public safety in the city of Columbus. Be happy to take any questions regarding our announcement today, and I'll stick around to answer questions about anything under the sun, but I may release some of our partners that are here if you have other questions. Yes, sir.
You mentioned this is going to go for 4 to 6 weeks, I believe. What are you hoping to see in that time frame? What to you would define success for this?
Well, I think it really is going to help inform where we go from here, building on, as the captain and commander have spoken of Spark and React and everything that we already have been doing. This pilot, I think, will inform future pilots, build upon what we know, lessons learned, where additional resources may be needed, where we may need to do additional training, and collaboration with, we have many different entities that are offering a variety of different services. So I'm not sure how to, Erica, maybe you'd be a good person. How do you define success? How does this pilot lead to this more comprehensive approach? Erica and Captain?
First and foremost, for us, this is a learning exercise. We plan to get the data, validate the data that's coming in from our 911 call center currently to help seed what will happen with 988 in the future and what system and network we need to set up to triage those calls going forward. And that's how when I think about it and how it would impact the system. But for the direct pilot program metrics, I think Captain Parrish is better suited.
Yeah, like I mentioned, I think just through inertia, 911 has become the default number for help. And one of the big numbers we want to determine is how many of those calls could have started somewhere else, whether through a crisis care line or through a mental health provider. But sometimes they try to call that provider and can't get through, and they call 911, and we have to respond based on limited information. So using that data to see how many calls are appropriate or could start somewhere else or better served somewhere else, and then also using the data to determine how many response teams and what makeup of each response teams. It's going to be a very tiered approach. We're kind of flipping the standard. We've always approached everything from the worst crisis. The house is on fire, we send 13 trucks. But somebody smells something funny, we send 1 truck and the house is on fire. We don't know that because of what we're told. So we want to start with that lower acuity response and build up, and it will probably decrease the number of high acuity response teams and really build out our middle level. So that's what we're using the data for. And working through the technology, we've got 3 different agencies we're bringing together. Who makes the final decision of who responds? So this collaboration and partnership is really important in using the pilot to work through that before we go live and figure out this isn't going to work. So,
Commander, Marion, what success look like for you all through this pilot?
I think again, just making sure that people are connected with what they need in that moment. The level of care, as has been shared previously, is just critical, and making sure we have the resources to connect them, as well as professionals that connect with them in a way that they can move forward and achieve a better quality of life ultimately. So to me, I look at it as a quality of life measurement, and just making sure we can enhance that and enable people to achieve their highest quality of life, no matter their mental health or their economic situation, just achieving a better quality of life.
I think the follow-up is the most important aspect for CPD, because we do a really good job of responding to that initial call, but then a lot of times we see maybe that individual comes back, we have to go back out to that house again. So really, I think the biggest part of this, how do we sustain success so fire or police don't have to go back to that same home, that we get them to the right place at the right time the first time, and that will help everyone and make it much safer community and help out the individuals.
What other questions do you have regarding the?
Encourages more people to make a call when they're experiencing a mental health crisis. Some people may not think, this isn't a real emergency. Maybe society hasn't deemed it as an emergency.
Yeah, I think it's going to be a great way for us to also engage and educate the public that there are times we need to call 911. There's no doubt about it, where there is, a person where there are crimes being committed and where safety is at risk. But, knowing that someone is battling an addiction or having a mental health crisis, we think that this right response pilot is perfect for that situation, to make sure that that individual and that family gets the support and resources they need. I think Commander said it best, or maybe it was Captain Parrish, that I think folks have automatically called 911 under all circumstances, sometimes non-emergency issues at all. And so part of this is educating the public, engaging the public, that there are other alternatives than simply calling for law enforcement if there is an individual at risk or a crime being committed.
I really appreciate that question and the mayor's response. It is about the education of what to do, as a matter of practice, but the acknowledgement is huge. That's exactly what we want folks to do. If the pandemic has taught us nothing else, it's okay not to be okay, to have concerns and fears and anxieties, and then to know when to act on them. And once you make that decision, how to act on them. And that there's a whole supportive network of caring agencies and professionals that know what to do and can shepherd and help you navigate the crisis care system. We want people to reach out for help. We don't want people to be alone and struggle with the illness. Reach out for help, even if you're not quite sure. And we want to make the network more accessible and more available. And this is, again, another step in the right direction, making that care more accessible to everyone who lives here.
The only other piece I mentioned is, another critical aspect to this, and the commander spoke to this. If we build out this system, it will allow us to devote more of our law enforcement resources, our police officers, to deal with the most pressing issues in this city, and that is the spike in violent crime. We get families and individuals the resources and support they need through this right response as we lead to this larger alternative crisis response system that Adam H. will be leading the way on, and that we'll have fully implemented in the next couple of years. But it also will allow us to devote more law enforcement resources to preventing and fighting crime, and ultimately doing more proactive community policing. And that's what our longer term vision here, right response at the right time, having our officers focus on our biggest needs, and ultimately freeing them up to do more proactive community policing in neighborhoods. Any other questions you all have for us?
People will get staffed in the 911 center in terms of doing the triage. How many people will be in there?
Captain.
So for the pilot, there'll be a paramedic, a dispatcher or a call taker from the communications center, and then a clinician from public health. So the call will come in originally to 911. If it doesn't meet criteria for an emergency response, it's not life-threatening, there's no safety concern, it's not a criminal act, they'll be able to forward that call over to the triage pod, do a warm handoff with the clinician, and then they can start to evaluate the situation more in-depthly. It's really just slowing the process down. 911 was built on a speed process. Get the call in, get it out, respond as quickly as you can. And now we're slowing that down and trying to figure out what is the actual need. And sometimes it's simply someone needs reconnected to get their medication refilled. And that may be a transfer of that phone call to another clinician to make that connection, and not a response at all. So it's just going to be 3 for the pilot. And again, the pilot will inform the hours of operation, how many pods are built, and what other partners are missing from the pod.
Any other questions regarding right response? I'll stick around for a few minutes. You can ask me about anything else under the sun. My guess is you might have some questions on other things. So I'll stick around for a few minutes. But thank you all for joining us here today and for this great partnership. Have a good day, everybody.
Thank you. Thank you.
Appreciate you.